Recognize the lady from Clarion County, Ms. Oberlander.
Thank you, Mr. Speaker. Just to clarify a couple of things first. Under House Bill 818, qualified health plans offered through a health insurance exchange cannot exclude coverage for any post-abortion complication, any miscarriage, or any complication associated with a miscarriage. This legislation does not prohibit any individual from purchasing abortion coverage for a separate premium outside a health insurance exchange. With those clarifications made, I believe it's also important to let the body know that this bill does not limit in any way a woman's ability to access abortion services. It does not limit a woman's ability to choose an abortion. It does not create any additional barriers to receive abortion services, and it does not contravene the federal jurisprudence related to the public funding for abortions. To be clear, this bill does not prohibit abortion. This bill maintains the status quo as it relates to public funding of abortions in Pennsylvania, maintaining payment in only the cases of rape, incest, and life of the mother. As a former member stated, and we've had many members speak on this, CHIP, Fair Share, and Medicaid, all public insurance programs in Pennsylvania, already limit the use of their funds to these three areas: rape, incest, and life of the mother. Most of Pennsylvania's 35,000 plus abortions a year are paid for out of pocket. The issue isn't whether or not a woman is able to get an abortion, but rather is whether or not those who disagree with abortion should be made to pay through taxpayer subsidies, taxpayer-funded administration, or mandatory insurance premiums through an insurance exchange to help fund elective abortions. I maintain that this is the reason our current policy doesn't allow payment now for elective abortions. In order to be sure that the policy remains as we move into this new age of federal health care, it's important that we elect to opt out of abortion coverage as afforded us in the Affordable Care Act, and as 17 other states have already done. I respectfully request your affirmative vote on House Bill 818. Thank you, Mr. Speaker.